Cupping is one of the oldest methods of traditional medicine, with origins that date back to the 4th century in China. Today, the practice continues around the world and is used to treat a wide variety of ailments. The two forms of cupping, dry and wet, are becoming more and more popular among athletes around the world, as therapist Hakim Saib Misri explains.
It's one of the best way to recirculate and release a lot of toxins, and immune system build up new fresh blood. That fresh blood, which is got energy and oxygen, so it supply you with lots of energy. That's the main reason, I'm sure, that everybody, especially the sports people, they like to use, because it gives them a lot of energy.
Western medicine is often frowned upon the unexplained and unexplored traditional medicinal practices. But for physiotherapist Richard Fairhair, cupping is beneficial and not a practice that should be discounted in the treatment of pain relief.
On a positive scientific note, cupping affects the pain gate theory, which is a well-established 50-year-old Western medical theory, which says that if you do that on the periphery, you will probably have an influence on the nervous system by decreasing pain. And if you can decrease pain, you can influence performance.
Today, professional athletes are under immense pressure to perform, and an injury setback is often unavoidable, meaning that reducing the recovery time is of the utmost importance, and is the reason why superstars like Michael Phelps are exploring alternative medicine options in order to find what works best for their bodies and cuts down the time they are out of action.
If you look at the context and content of South African tribal or herbal medicine, which has come into the spotlight lately with the Department of Health, certainly 90% of the country has a strong influence there, and so yes, they can work together if regulated and thought through carefully and properly, and if I can mention, providing no harm comes to any individual.
Due to the demands of their sports, athletes can never guarantee how long their careers will be. That is why it is imperative to find the most effective treatment for specific injuries in order to prolong their ability to earn an income and ensure that their rehabilitation prevents further injuries. So whether it is alternative treatment or Western medicine, it shouldn't matter. And the sooner traditional and Western medicine find some common ground in the treatment of injuries, the faster athletes will be back out doing what they do best. Sias du Plessis, CCTV, Johannesburg.